should I be looking at a situation where I pursue surgical intervention earlier or later?
It really depends on what the problem is. And so you could have, even as a relatively young man, you could have an obstructed bladder neck. So not necessarily a prostatic problem, but where the neck of the bladder, so right at the top of the prostate, and I might show you some images of the anatomy of the male urinary tract. The bladder, you can see its muscular wall and then its lining, which has properties that stop the urine being toxic to the underlying tissue. And then the urine passes through the prostate, and the role of the prostate is it modifies semen, so it has a role in fertility, but also because it enables the urethra to stay closed, it has a very important sphincter function or valve mechanism that keeps men dry. And this is why some operations that involve the prostate, for example, removal of the prostate or radical prostatectomy, which is sometimes done for prostate cancer, can also sometimes result in urinary incontinence and stress incontinence in particular. But also, if that channel that goes through the prostate is being pushed on by the prostatic tissue, the bladder may have increasing difficulty clearing urine. What I was saying before is that it can occur up here at the bladder neck area even before there's substantial prostatic growth. So a guy could have symptoms of urgency, frequency, even urge incontinence, which is getting progressively worse. And the good thing is that in the majority of cases that is treatable and a lot of times reversible. And we see over time that the muscle of the bladder wall, which becomes overactive when there's a downstream obstruction, can actually remodel back towards normal or even to normal if obstruction is relieved either at the bladder neck or if it's in the prostatic, we call it the lumen or channel. If these prostatic glandular areas are obstructive and we take away the obstructing tissue surgically, that can then result in reversal of the problem with the bladder. But where we've got it wrong in the past is that where people have had bladder control problems, we've thought of that as a bladder problem, not necessarily recognising that in fact the prostate could be the cause of that type of problem. How you can work out if the prostate's responsible for bladder symptoms is by studying this directly. And I might show you a video later of a type of study that we do called fluoroscopic urodynamics, where we put a catheter into the bladder via the urethra and measure the pressure during urination. So measure the storage pressure and measure voiding pressures to see whether or not the prostate is obstructed. Because what we've discovered is that if patients are obstructed and they have an intervention to relieve obstruction, that in fact that's much better than if you do the same intervention which was happening in the past and they're not obstructed.